Good afternoon. I'm Dr. Sonia Fuqua, and I am the Chief Clinical Services Officer for the Community Health Center Association of Mississippi. And I'm really excited to be here today with Dr. Yvette McLaurin, DMP. She's the Chief Medical Officer for G.A. Carmichael Family Health Center. Thank you for being with us today and sharing in this little exchange of information about your thoughts around healthcare today.
Thank you for inviting me.
So I have a few questions for you. And the first one is, when you think about the future of health centers, what opportunities or challenges do you believe we must address today to ensure stronger, healthier communities tomorrow?
Okay. Well, as you know, access has always been one of the number one challenges as it relates to healthcare. When we look at access, it's multi-layered. It's just not being able to go to a facility. Sometimes the number one challenge that I see is transportation. So with transportation, we got to find strategic ways that we can help the people get the services that they need. And one of the ways that I think we should do it is to work on digital health equity. And when I mean digital health equity, I mean working on those digital infrastructures. Some of these communities do not have access to broadband internet services. So if we find ways that we can invest into the digital infrastructure, this will allow for us to reach patients through telehealth services, and so then we can access more communities.
Well, I appreciate that, and I see you're really recognizing pathways forward to enhance quality of care for your community patients. In what ways has your health center's deep connection to the community shaped the care you provide, and how can we build on those roots to prepare for the future?
So one of the things that we have done is to increase our presence in the community. Again, transportation is an issue, so we started doing things where we can reach the patient where they are. So we're doing more community outreach programs. We're partnering with local churches, partnering with local businesses to offer services to their individuals that take part in their services, so that we can also offer health care in that way.
Awesome, because partnerships are key. We're all in this together, so we need to come together and work for the common goal. So what has been the most valuable lesson or insight you've gained during this conference, and how will you apply it at your health center?
So one thing that I found very interesting was conducting those multidisciplinary healthcare teams. We as providers, we refer to social services, we refer to pharmacy, we do referrals to different entities, and having every discipline come together in that team meeting where we can identify certain patients that are at high risk and talk about those patients' care and come together with a plan is one thing that I found very interesting. As I said, we do the referrals to social services and things of that nature, but coming together as a group to talk about that patient, I think that's very something that we should start doing.
Exactly, because each discipline has their perspective to bring to the healthcare. Now, how has the conference helped you build or strengthen connections with other health professionals and organizations?
Coming to conferences like this, you're able to find new innovative ideas. You're able to find out things that people are doing at their health centers that have worked. You learn about different new technology that's available to help the patients. And so attending conferences is always a good idea.
Well, I appreciate you saying that. Again, thank you for being here, and I'm glad that you can see the concept of share seamlessly, steal shamelessly. We don't always have to reinvent the wheel, but when we come together, we can learn what others are doing, and if possible, we can implement that in our health centers as well.
Yes.
Thank you again. I appreciate it.